after surgery, what we do is we have the breast covered with steri strips or dressings that will remain in place until your first post-op appointment. And then we remove those dressings for you, take a look at the incisions, make sure that everything looks great at that first week. We replace it with fresh dressings. You can go home and shower at that point. At about 3 to 4 weeks, once all the incisions have healed, we start to apply silicone tape or gel to the incisions, and that really helps hydrate the wound, help the scar heal. And now initially your scar will be a little elevated, it will be red. The scar maturation process can take up to a year, and you want to avoid the sun during that period of time or reduce any tension that can occur across the incision. So the silicone taping really helps in that regard. It's the best evidence-based practice for, silicone taping, silicone gels, staying out of the sun. That can really help your scar mature and look aesthetic over time. The scars never disappear completely, but they do fade. Of course, if after surgery, for whatever reason, you end up having a little bit of extra tissue on the side called a standing cone or dog ear, which usually occurs on the side or in the middle, we can offer revisions for those at a delayed time period, 3 to 6 months after surgery, after all your tissue swelling has resolved. Most patients are very, extremely pleased with their surgery. Asymmetry is, one of the more common complications after surgery as well, because everyone's asymmetric in some regard. We say, breast or sisters, not twins, or the chest and nipple areola positions may not be perfectly symmetric, but we try to get them as aligned as best as possible. I don't leave the operating room until I'm completely happy with how things look. Liposculpting, of course, can help achieve some of the definition in the upper chest, the sides, and along the folds. Small asymmetries are common among all of us. Nipple and areolar graft survival, that's also a potential risk of the surgery. Not all of the nipple grafts may survive. It's extremely rare that they don't, but if that happens, it's usually just part of the nipple or the areola has a small wound healing complication that involves application of Vaseline or some gel. So we've talked about hematoma, seroma, scarring, and wound healing. Small wound healing complications are rare, but if they do happen, they're sometimes related to a suture, extrusion. They usually involve very low maintenance wound care afterwards. Complications aren't zero from surgery, but typically they're very rare, and we're here to help guide you throughout the process. Emotionally, this surgery can be transformative. Patients often describe feeling more at home in their bodies, more confident in social settings and in self-expression, and more aligned with their true selves. It's not just about physical change, it's about peace of mind, self-expression, and finally being able to live authentically. So if you're considering top surgery or simply want to learn more about your options, we're here to guide you through every step of the journey. Feel free to contact us at 212-427-3982 or visit us online at breastsurgerygroup.com to schedule your consultation.